my name is Evelyn Castle, and welcome to the second episode of the EHA Founders Podcast, where myself and my co-founder Adam Thompson talk about the companies that we founded, some lessons learned along the way, and some of the challenges that we faced. On today's episode, we talk about the first 2 years of starting eHealth Africa, which is a public health nonprofit based in Nigeria, and I'll include the link to EHA's website in the description below. But the time period that we're talking about is roughly from 2010 to 2012, and this was a really challenging time for us because we had very little money and we were really trying to get the company started up and running properly. And at this time, we were based fully in the north in Kano, Nigeria. And you're going to hear about some of the very first projects that we did, some funny stories that happened along the way. And to give you an idea of age range, I think at this point in 2010, I was 21 and Adam would have been 27 at that time. So I hope you enjoyed this episode. All right. Good morning, Adam.
Good morning.
All right, so today we are talking about basically everything that we did from when we came back to Nigeria in the summer of 2010, all the way up until basically we started getting our work for polio. And it's kind of funny, like looking back, because what do you remember about that? Because it was kind of a big period. So we didn't get polio work until
2013.
Well, we started the conversations in October of 2012. So it was basically half of 2010 that we were there, all of 2011, and then half of 2012 before we even started getting the polio work. And for whatever reason, in my mind, I feel like it seems like we started that part so much sooner from getting there. But I guess, I mean, we did, and we'll talk about it today, like each of the different projects, but we actually did a ton of work before we even got the polio work.
Yeah.
So I think it's just maybe because polio was such a big change in the organization that's why it comes out like there was little before that. And then polio was like the next big thing. So that being said, we do kind of have a lot to go through today about what these different projects were. But, let's kind of look at the timeline a little bit. And, we left off last conversation about, what we thought, getting on the plane going to Nigeria. Neither one of us necessarily thought that it was going to turn into what it was. But now we're starting today basically from landing in Nigeria. So I forget exactly when we knew that we were going to be homeless when we got to Nigeria. Did we know that getting on the plane? Like, I feel like we knew that like at the airport when we were getting on the plane, we heard that the living arrangements that we had secured
had changed.
Yeah. Do you remember?
Yeah, we'd already kind of committed to going. And so we thought we had that situation secured. And then we were told that someone else was there now and renting it. So we had to sort something else out.
Yeah, but I'm pretty sure that we got on the plane knowing that and just were like, well, it, like we're already in this, like let's just go sort it out.
Yeah.
And I was trying to remember also kind of like how much money we ended up going with. And I remember like I think I was able to raise we were able to raise in grant money, it was like 10,000 from the Strauss Foundation, 10,000 from I think I was able to get another like 5,000 from those other competitions. So maybe 25,000 from like scholarship stuff. And then you pulled out your savings, which was
between 40-ish.
Yeah. And I mean, I was 21, so I think I maybe had a couple $1,000s in savings as well, too. So we're talking, we definitely went with less than 75,000. But I remember we ended up buying quite a bit of equipment before we left, too. I think we spent most of the grant money on equipment, and then we went with your money as living expenses. Yeah. So we're going to talk through these different projects because I went and found our budgets and they're absolutely hilarious. But there's no way we were able to sustain ourselves on that money. So I know you were getting unemployment. Do you remember how much that was each month?
I don't remember because it was like a kind of like a severance from the university, and it went on for a while, and it was some portion of my previous salary. So it wasn't small, but it would have probably been around like 50% of my previous salary or something like that. So, $1,500 to $2,000 a month, probably closer to $1,500 after taxes and things like that.
Mm-hmm. And I feel like we were living really frugally at that point because I don't ever really remember a time. I mean, I remember all of us always being concerned about money, but it wasn't like we don't have enough money to eat.
Yeah. I mean, we had to eat very, very cheaply.
Yes. Correct.
I mean, luckily food was relatively cheap in Ghana.
Yeah.
Buying stuff at the store, obviously, not buying stuff at hotels.
Yeah. Well, so we land in Nigeria and we go directly to the Tahir Guest Palace, right?
We stayed in Abuja for some period of time because we stayed at the Bolton White Because remember we met Joseph, Dr.
Yeah.
Joseph from the such and such thing.
Oh, the Society for Telemedicine
Yeah,
and
Society for
eHealth.
Telemedicine eHealth.
So we flew into Abuja at that time?
Yeah.
Okay.
Because remember, we didn't actually even have transport up. We kind of had to sort that out.
Oh, yeah.
And between, I think, Joseph and I think Steve, they helped us like arrange a driver.
Yeah.
But like after a week or two, like because we were here for a while,
Mm-hmm.
like a week or two in Abuja, and more like 2 weeks, at least 2 weeks in Abuja. And then we were trying to decide if we're going to Kaduna or Kano because we still didn't even know yet because we didn't have housing.
Yeah.
And I know we stopped in Kaduna because then we met with the Pathfinder folks.
Yeah, and I remember we went and we stayed at Dr. Mero's house.
Yeah.
Yeah.
Yeah. So we did that. I think we did that for a while because we spent a while meeting with Dr. Sada about different options and ideas.
Mm-hmm.
And then we went to Kano. And I don't remember after which amount of time.
Okay, this is starting to make a little bit more sense because when we go into some of the projects, I couldn't remember how some of this even started. So that makes sense. And I remember we did that thing with the girl child concerns where we were like supporting them with some, I think we did some like trainings for them on the computer or something like that. And I want to say it was like Mero's house, but it was a bunch of little kids, like young girls that we were teaching them how to use like Microsoft Word. But that was for like a couple days that we did that. Okay, so we get up to Kano finally. The reason why we chose to go to Kano is, now that you're saying this, is I think because when we were in Kaduna, we were talking to Dr. Sada about doing open MRS in Minjibir. And then also I think we must have gotten the contact at that point about the Immunokano Teaching Hospital. So I'm guessing that that's why we ended up saying, okay, well, let's just go to Kano.
Mm-hmm. Well, that was our plan. I mean, but we knew that was going to be our base at some point. But
yeah.
And we were able to get office, right? ECNX was able to give us like an office space, but we didn't have a place to live.
Yeah, exactly. So originally we were going to go, and our friend Jihad, who was the managing director of ECNX, said that we could live there. And then he ended up sending his family to Beirut, and he moved into the place that he was offering us to live.
Well, and then the other place he had free, he then rented to
Perfecto,
the Spanish manager.
But I didn't realize that he had also offered us the office space too. So that's why we still had that, at least going into it. So we get to Kano, we go to the Tahir Guest Palace, and you somehow convince them to give us like some ridiculous rate of basically free to live there.
It wasn't free, but for them, I think it was quite discounted.
Yeah.
I still don't think it was much cheaper than like $1,000 a month. But
Yeah.
like that was, a lot cheaper than it would have been.
Yeah.
Because even though it was Kano and the Tahir Guest Palace, a room was $100 a night.
Yeah.
And so we paid less than a third.
But it is kind of funny though, because like Tahir Guest Palace today is quite nice. Tahir Guest Palace 10 years ago was really you remember the restaurant that they had? Like it was pretty bad.
Hotels 10 years ago were all really dire.
Yeah.
In Nigeria for some reason. It was only in the last like 5 years that people really kind of picked up in terms of like the kind of quality and the, whatever it was.
Yeah.
Back then you just needed a huge room with a really uncomfortable bed, and that was
it.
Some gold things, and then you were fine.
Yeah. So they gave us the smallest room in the hotel, and the bed basically took up the entire room. I think there was like a 1 foot like parameter around the bed. And I just remember like the electrical was really shoddy and thinking like we're gonna kill ourselves trying to make a cup of tea in here. But we must have stayed there for about a month or so before we ended up moving in with Perfecto. Yeah. We didn't pay rent, did we, when we moved in with Perfecto?
We did, yeah.
Oh, we did.
Yeah, we made an agreement to like pay half the rent.
Okay.
Because I think he was paying 700-ish euros.
Okay.
So we ended up paying about $400, I think.
Okay. But that was like
a big saving.
Such a better situation.
And,
yeah.
Much bigger space.
But I just remember like you and I having that conversation where, so Perfecto only spoke Spanish and our Spanish was not great. And, he kept on like inviting us to come live with him. And you and I were just like, is he joking? Are we understanding his Spanish? And I remember at one point we were just like, well, like whatever. I don't care if he's joking or not. Like we're just going to do it. Yeah. So that's how we kind of get into Kano and get living. And very quickly I realized, based on looking back at my pictures, you bought that stupid motorcycle. Even before we were living at Perfecto's. I think you bought it when we were still living at... Yeah. So, do you remember buying it? Like...
Yeah, because I even went to like the factory. I went to the Royal Motors factory to buy it.
And we had brought our helmets from the U.S. So, at least we had helmets and we're ready to go.
Yeah.
Different times, so...
It was useful to have, though, because we were going back and forth like to all these different places. It was much better than trying to sort out taxis and...
Yeah. And I think maybe when we go into some of the projects, we can talk about like when we finally were able to buy a car, which again, I don't actually, looking at these budgets now, I don't even know how we managed to do. I just feel like things have gotten so much more expensive now than they were back then because I don't know how we were able to afford some of it.
Yeah, I mean, the exchange rates changed dramatically.
Yeah. So yeah, I think our first project when we got up to Kano was talking about doing open MRS in Minjibir.
Mm-hmm.
And we actually did that. I think we had the computer and everything, and we went and did that training up there for them.
I mean, that was Pathfinder paying for it.
Yeah.
I don't know that they paid as much for it, but yeah,
I think maybe they paid for the equipment, but they didn't pay us.
Perhaps,
yeah. I don't really remember much about that project. I just remember doing it. But
I mean, I remember a lot of it just because there was a lot of like weird things to sort out with like, well, how to power it because we needed to get a generator for the medical records team. And I remember meeting like the head medical doctor because he was this Nigerian that had like studied surgery in Russia.
Yeah.
But then he was also the medical director and, you know, just trying to sort out like how they ran the programs and stuff like that. And, you know, just like as you would expect, it was quite a mess of a hospital. So it was like putting medical records in a place where you're just like, how do they even practice medicine? And so it's like, you know, it's one of those things where you kind of look back and you're like, well, they had a computer, but like they don't have
roof. I remember part of the building didn't have a roof.
Yeah. And so there were those kinds of challenges of like, well, yes, the data will really help, but like, you know, what's being provided is not medical care, not really, especially for a general hospital, right? Like that was the challenge then.
So we did that, and then I found this thing that I thought I would show you, which I thought was really funny. Do you remember this? The solar suitcase.
So that's not the solar suitcase from the group.
I know it's not from We Care Solar, but it definitely said solar suitcase on it.
Written
on it.
It was like something that someone sold in Nigeria. I think it was something like Jihad brought, and he just gave it to us.
I think you're right.
Because like someone was like trying to sell them.
Yeah. But I remember at the time thinking like this was actually pretty innovative, you know?
Yeah.
But we never ended up doing anything with that, did we?
I'm sure we put it somewhere.
Yeah.
I don't know where.
All right. So then the next kind of big thing that I remember spending a ton of time on was this project in Minokana Teaching Hospital. And in my mind, I remember that we were just doing like research or something. But I went back and we wrote a full proposal to Minokana Teaching Hospital for us to do an electronic medical record system there. And our budget we gave them was 37.5 million naira, which I think the exchange rate back then was like 155, which comes to like $250,000. But I think we really thought they would pay us to build a medical record for them.
I mean, based on everything we talked, but what happened is like some other contractor came in and was awarded a contract from the federal government, and but they were probably paid about the same thing. I think it was one of those things where they literally took our proposal and like someone else then showed up and was like implementing it. But then it obviously, I mean, to this day, it's not there. I mean, it's just never went anywhere.
Obviously. I remember I spent like a lot of time just sitting at that hospital, meeting with people, working in the records rooms, things like that.
Well, I think that's always just the biggest challenge is like those early proposals, like, you know, the medical record systems would help, but what needed to happen was like a complete restructuring of how different parts of the teams and departments worked and flowed together. And at the end of that was never going to happen. Like you weren't going to change a teaching hospital to like change how nurses and how different teams work together. So that's where it just like, even the people that did eventually get money to do those things, like they just fall apart because it's, you can't do a medical record system without process change. And you can't build a medical record system around a really chaotic hospital that doesn't have any actual processes or processes that are efficient and make sense.
Without, a ton of buy-in from everybody on top, which wasn't, I mean, I remember everybody being really nice and kind of like supportive of the general idea. Yeah. But it is kind of crazy that, 10 years, looking at it back then, again, 10 years down the line, I don't think anything has really changed.
No, not at all.
That teaching hospital runs the exact same way as it did 10 years ago.
More or less, yeah.
All right, so we're still in the first 6 months where, we are kind of like trying this thing out. I remember we did, I guess, the visit back to Kaduna, the Society for Telemedicine, or the Shehu Idris College of Health Sciences and Technology, where we did the first EMR system. I guess maybe we went there again along that road, but I think we actually went back a couple of times to meet with them. Yeah. I looked back, I had forgotten, during this time we did that visit to the Millennium Villages in Kaduna. So we kind of just were
meeting people,
learning, going around places. And then the next big thing that I remember is getting the scholarship to go to the Open MRS conference, which you had gotten the year before, and then I got this year.
I think so.
Yeah, it is. Remember?
For some reason, I think you went first.
No, you went first because I remember because I was pissed. You got it when we were back at college. And I also remember because you were pretty annoyed that they wouldn't give you a scholarship again this time to go, that they would only give me one. Like, I do think that like that Open MRS conference was like a pretty big deal because we got so much support and kind of like shout outs and love from that group of people, and it's funny looking back at like, again, kind of like people who just are like wonderful human beings. I got the scholarship to go to Cape Town or to the Open RS conference. And then if you remember, we had gotten our abstract submitted
to MedInfo.
Yeah, to MedInfo, but we didn't have any money to send me there. And so when I got there and I had told a couple people that we had been accepted, but I didn't have the money to get there and all of that, Andrew, what's the guy from Open MRS? Yeah, Andrew Cantor said one of the ladies that was supposed to be with them couldn't come, so he had a free room because they had rented like this giant like multi-room villa thing in Cape Town. So he's like, I'll drive you there. I'll get you there. You can stay there. And then Hamish Fraser, the day of entering in, basically, I think tried to talk my way into the conference. But then when he couldn't, he just pulled out his credit card and just paid for my ticket, which I don't think was cheap. I think it was like a couple $100 so that I could stand up there and present our paper.
So when did we do the mapping project with Pop Council?
So I'm telling you, like, I spent 2 hours yesterday doing this timeline because all of this was all jumbled together to me. So we will get there. So we hadn't even started doing any of this yet, but I think that actually that conference ended up being a lot of good connections for us back in Nigeria and then kind of like, in that space, I guess, in general.
Because you met Gabo.
Yeah, so I think that was really funny. So I met Dr. Mendy at that conference. Do you remember when I called you and I told you I was going to stay at the IHVN guest house?
You didn't say it at the IHVN guest house. You said, I met this guy and he has a place for me to stay in Lagos. That's what you said. It was only afterwards we found out it was IHVN and there was a formal guest house.
I think whatever he told me, I probably told you. But I just remember you being like, so let me get this right. You met some random guy and you're going to go stay with him in Lagos. You're like, hell no, you're not. You're going to go to the damn hotel. Funny, because then we ended up
staying there a lot.
Well, I think we stayed at the IHVN guest house like 1 or 2 times, but then obviously we stayed with Gabo all the time. So it was kind of funny. But yeah, at the time it did seem a little bit sketchy. So I get back from there and I think it's right around here, just before, we're talking like October, November, that we end up meeting Andrew Carlin from Population Council. And that's when...
But I don't remember where or how.
That's what I was going to ask you. I don't remember where or how either.
Odd.
And I couldn't find anything. All of a sudden I looked at his email.
Yeah.
And then I went to try to find like back in my history as to like what the first emails were.
Yeah.
But obviously we met and then he just started forwarding a bunch of like information to us. And that's the first emails that I have from him. I think you were introduced to him either by Paul or maybe by Dr. Mayrow.
It would have had to be Dr. Mayrow. Paul didn't know Andrew.
Yeah, because I don't really remember, because again, at this point, like we weren't really spending much time in Abuja, so I don't really know how we would have met him. But anyways, we meet him and we're getting up really close to December, which is when we had our tickets to go home. And I did go home that December. I'm guessing you did too. But then I guess at some point we had made the decision that we were going to come back anyways. But in October, November, we start talking to Population Council about using ODK for like a drug user project that they have. And we got paid to do it. Andrew Carlin paid us to do it. I went back and I looked at the proposal and the budget. Do you want to guess how much they paid us? Take a wild guess.
The Pop Council.
Yeah, for that initial ODK drug users thing. No, the MCBS was after. This was just that ODK form that we did. And remember that training that we did for them at ECNX.
Yeah. $30,000? $10,000?
So the whole project was $12,500. And I think that was also to buy some equipment. And then you and I got paid together.
Yeah.
$2,500.
Nice. Yeah, that was 2011, December of 2011.
No. That's December 2010.
Oh, but then there was some map we did for the infectious... Oh, it must have been...
Yeah, I remember I did that with
mapping.
Habiba way later. Yeah. But so this is just before we're about to go on with the rest of our lives. And we get this contract. And this is when we say, we're staying. We've made it. We're successful. Screw everything else. We're coming back to Nigeria in January.
Yeah.
Do you remember some of those conversations? I mean, so, again, the original point was that we were going to go for 6 months, then we would go back on with our lives. I was going to go back to college. You had quit your job, obviously, but you had gotten that Ashoka fellowship. And so I think that was in Lagos, wasn't it? So you were planning on maybe going to Lagos.
Yeah, I think that was the plan.
Mm-hmm.
Yeah, so I had the Ashoka Fellowship, so I would have stayed in Lagos.
Yeah.
But then other projects came on board, and we decided to.
It was just the population one that we knew at that point. But for whatever reason, we just felt like we've made it and like this has legs and like we need to see this out.
And you're saying that was 2010, end of 2010.
Yeah. I do remember actually making that decision. Like, I vaguely remember having an argument with you in the living room of the ECNX apartment.
Mm-hmm.
And I remember, like, we just kind of both were really, I think, stressed because we had to make a decision about what we were going to do.
Mm-hmm.
And I remember, like, arguing about it. And then I think we just finally were like, you know what, we're just going to come back and keep going. Let's do it for a year.
Mm-hmm.
I don't even know if we put a timeline on it or if we just said we're just going to do this and see where it goes.
Everything was like in 6-month increments, and then eventually there were no more 6-month increments.
Well, and the funny thing is, I think the reason why it was 6-month increments was because
visas or something.
No, because of the plane tickets. If you buy a plane ticket that has a return date more than 6 months, it like triples in price. Yeah. So we would always say, okay, well, here's like our plane ticket, and then yeah.
Because I mean, I'm seeing because we were invited by Pop Council to join the CDOS project in February of 2011, so just like that would have been like right after we got back.
But that was after, so we did this first one and it was kind of like a really small project doing ODK. And that's what I'm saying. Like, I think it's really funny that we got this little tiny project and that was enough to be like, we're in.
Let's keep doing it.
Yeah, let's keep doing it. I mean, obviously we probably had started these conversations about the other stuff, but I mean, nothing was confirmed at that point. Okay, well, it was obviously a big point and decision, and yet neither of us really remember making it.
Yeah, remember what the trigger point was, because I can't remember what I would have said, because there would have been something like a contract in hand, and we decided that we should do it.
I think we did that training for the drug users. Well, obviously we didn't train drug users, but it was like right up before Christmas, just like right before we were about to leave for holiday. So then, yes. So we come back 2011 and we start off with the Population Council, the CDOS project, where we did the CBS, which was mobile community-based
surveillance.
Was it surveillance? Yeah. So that was for 40,000. And actually we made pretty good money on that. I mean, so we made together 11,700 was the budget for our salaries, which I think considering was pretty decent.
Yeah.
And I remember what I did on that project. What did you do on that project?
So MCBS was an SMS-based project, so I'm sure I did all the programming for Rapid Pro.
Oh, yeah. There was the SMS stuff. Yeah. You're right. Because I remember we did that big survey in the beginning where we did ODK and we went house to house in the village and did like a big survey thing about it. And then, yeah, there was the SMS piece after. Oh my God, I totally forgot actually what that project was. Remember?
Traditional birth attendants.
The traditional birth attendants would put a pebble in a different colored jar depending on what happened. And they're illiterate, so they had to remember, like a green jar meant a good birth. Red jar meant a
hemorrhage.
Yeah, but it was like 10 jars. That was really complicated for people to remember. Although then I wouldn't say we made it so much easier on them. We then said, okay, instead of putting a pebble in a jar, you have to send a number to a system.
Well, there was a lot of debate at the time about whether, because the idea at the time was that community health workers were doing this, but then the state was like, no, we don't have community health workers because we don't want to pay them to do it. Use traditional birth attendants and said they're free.
And then remember we got there and we realized that they couldn't count.
Yeah.
And so we had to teach them how to count first. Yeah. But then we had to teach them how to use a phone. Then we had to teach them how to send an SMS. Yeah, that was a fun project.
Yeah. But yeah, but we did a lot of things around that. Because it was the surveys. Because I was just looking, we had our own mapping servers set up. We had some interesting things, visualizations set up.
Yeah.
Pretty early on when those tools were hard to do.
So we did that project. That was definitely a fun project. And I remember it was a lot of travel from between Kano and then Zaria. And I remember that terrible hotel. What was it? The Zaria guest house or whatever. Yeah. And then we would take the bus from inside Zaria, me and one of the intern girls at what was that NGO that we worked with that Dr. Shitu was part of? I don't remember, but one of the interns there, we would take this big bus back and forth from the college every day. Yeah. So, I think that was a really good project for us though, because it was a lot of community work, kind of learning how things go. It was fun. Yeah. Then the next big project that we get is IHVN. So obviously this was born out of the conference in Cape Town. We knew Gabo. We had met with him a couple different times, and he wanted us to do open MRS for, what was it, like 30 hospitals in Nasarawa State, something like that.
It ended up being 200. Like, it was in the hundreds.
Yeah. And actually, now that I am looking back at the timeline, we had started these conversations prior. I guess that's what it was.
I think we even probably built part of the system already before that.
Because I remember I went and I did that field visit with him in Nasarawa. And the only reason I remember this is because you called me like 8 times that day, like one day. And I was like, why are you calling me this much? Like, what is happening? And it was your birthday. And you kept calling me to see if I were to remember and say happy birthday to you. And I didn't remember. So, and I remember I was in Nasarawa with him, with his team, doing the evaluations of the hospitals at that time. So I guess that must be what was the trigger.
That would have been in December.
That's what I'm saying. So that's probably what the trigger was as to why we said we were going to stay.
Because then we had a contract by like May or earlier?
Yeah, it was about May. Yeah. A little bit earlier than May, I think. April or so. Yeah. Okay. But obviously that was in conversations. So that's probably why we ended up staying. Yeah.
That's when we bought a car.
Yes, that is correct. But I still don't understand how, because when I looked back at the budget, the final budget was about $50,000. Yeah. And so we must have taken about $30K of that and bought a car with it.
That must have been the initial budget. I remember that project because once it was scaled up to 200, it was about $200,000.
We didn't get the amounts to buy the equipment. They did all that on their own. We just set it up.
Yeah, we didn't do a procurement contract. So you're saying that the total project budget was like 200, but we only got 50?
Yeah, so it was 50 for travel, for our time, for everything. But I mean, that was enough at the time for us. We were rolling, you know?
I really thought it was more than that, but yeah.
Yeah, I thought it was around 75, but I guess 50. So yeah, we got that project, and that's when we hired Joseph, and started working on that project. And I feel like that was the first project that we got where we started to really get a glimpse of like Nigerian NGO bureaucracy.
Yeah, but that went on for 2 years?
Something like that, yeah.
It had to be more than 50 because like it definitely was like extended at some point.
Maybe, and maybe I just didn't find the extension to it. Yeah. The original contract though was for 50. Yeah.
Because I'm almost certain it was in the 100 range.
Yeah. You're probably right. It probably got extended because I do remember, I think we started with 30 and then it got extended.
Because there was this whole thing where we had to like rebuild the whole syncing mechanism with OpenMRS and then extend it so it even support the hundreds.
Yeah. So it's really funny though, like just looking back because we're not even close to polio yet. And I still have like way more projects to go through. Yeah. So at about this same time, we meet Robert. I guess in Nigeria, right?
Yeah, I met him at Marriott.
Marriotta's, yeah. I wasn't there, but I remember you telling me.
And he didn't know about us or the project at the time. He was just there with another UNICEF project. Yeah. And then someone had introduced him to me and said, oh, they've also done this rapid SMS stuff.
Exactly. So you meet him and you go to Cameroon in May 2011. Yes, I know this.
Yeah.
And then I was really pissed off that you got to go to Cameroon and I didn't. And so I got a cat.
Yeah, you got And that was funny too, because like I remember on the way to Cameroon, I was staying at IHVN's guest house, like
in Lagos,
working on some visualization for MCBS. Or no, actually it was for the older project because they were doing a paper on it because there was a conversation with Andrew.
So yeah, I mean, I guess like that whole year or the majority of that year, we're doing the MCBS project, we're doing IHVN, and then you went and you did the Cameroon stuff. But I don't think that was like as much of a work. It was kind of like, how long were you there for? Like a month or something,
At least. It was probably more than a month. It was like 4 to 6 weeks.
Yeah.
Because remember, that was also quite lucrative for us. Not because like the project, I think value was small, but UNICEF pays really stupid per diems.
Yeah.
And the per diems were more than we were actually charging.
Yeah.
And because like we were used to eating on a very low budget, I didn't need whatever it was, like a $700 per diem per day or something stupid.
No, I remember that was great. And then I guess also during that time, we were setting up the We Care Solar project. So we get the We Care Solar project in around November 2011. And again, I feel like we started making money on this point. So we did that project for $15,000.
Yeah.
It was a pretty low budget project.
But a lot of work for a low budget project.
That's the other project though. Like I did so much like pre-work for that project. Remember, we had the whole survey. I think I went to every single health facility like in Kano State to do the assessments. We ended up putting solar installations in, I think, 50 facilities.
Between Kano and Zaria.
Yeah, but I think we ended up doing more in Kano just because it was more convenient for us and cheaper. So when they came, I think we ended up doing more of the ones in Zaria. That was actually a really fun project. It just wasn't fun necessarily working with the people on that project.
Yeah. Well, yeah, they kept wanting us to like donate our time, do things for free. And we're just like, but they were raising a ton of money to do it. So we're like, well.
I looked back at some of the emails and I was reading some of them, and there was one from the CEO or whatever, and she's asking what the status is. And my response was, well, you stopped paying us in February, so we haven't done anything since February. And then I think there was like an exchange back and forth of like, well, we needed this information. It's like, well, then pay me for this information.
Yeah, it was very strange. They had a very strange idea around that. Like we would somehow want to donate our time to them because their cause was so worthy.
Yeah. Do you remember how we met her? I mean, she was in Berkeley, so I'm guessing we met her through one of those competitions that we did.
She and her husband used to come when I was still teaching.
Yeah.
And we used to do case studies with them.
Remember the citrus competition at Berkeley? I think we both won like an honorable mention or something like that year.
I mean, it's very possible, but she was working on her PhD by then and her...
Mm-hmm. No, I remember we both won the same award. Yeah, on that competition. But that was actually a really cool project to have done. Mm-hmm. And I think we worked quite a bit with like the ECNX electrical team in order to implement that project.
Mm-hmm.
Yeah. So that's everything that I have for 2011. So then apparently I went home for Christmas, and I think you stayed in Nigeria because January 2012 is when Boko Haram takes over Kano. And I remember you were there and I was not.
I definitely went somewhere and came back. I don't know that I stayed there.
Maybe you just went for a shorter time or something. Yeah. So then 2012 to me is like the year of ODK because I just feel like that was my entire life that year. Mm-hmm. So in 2012 is when we get that JPAL project where it's like 1,000 questions with like skip logic on every freaking question, and I'm emailing back and forth with Yao and Carl asking them like...
I think it was the biggest form they'd done at the time.
Yeah.
Like they were still updating ODK so we could actually run a form that big on a phone.
Yeah. And remember, we ended up giving them a contract to do some things like where they could lock the form so that the people couldn't delete it and things like that. Yeah. And even I think it was to choose how to send the form and things like that. We ended up paying them to make some of those changes for this project. Yeah. But I just remember wanting to die doing all of the coding for that ODK form. And that must have been the project. I guess it was that one, and then we'll get to the Nomads work in a second. But like, remember we had that small office at ECNX, and at this point we had Zainab and like Husseina and like one or two other interns. And I remember we had at least like 100 phones, set up across every desk, and every desk we're going and we were like setting up the ODK forms. I think it must have been this project, but that was kind of a ridiculous experience. So yeah, I mean, that was just like a ton of like manual work in order to set up all of those phones, which was kind of crazy. But at least at that point, we had a couple people working with us, so it helped. And then that same year, we continued this UNICEF nutrition survey, which was kind of cool. And so it was March 2012 that we went to Senegal for something like 4 to 6 weeks. But again, I remember we just were making so much money because both you and I were getting per diems. And remember we would like go out to eat and we like thought that we were like big spenders. Remember that Italian place that we went to that was like down the road from the hotel? And just like, oh yeah, we can get whatever we want.
Well, because just couldn't wrap our head around like how much UN groups paid for per diems. It was so weird. Every meal you basically had almost $100, like especially in those big cities like Dakar, those expensive cities.
Yeah, but that was a pretty cool trip. And again, I think that was like definitely the first time that I had been to. That was the first country outside of Nigeria and then obviously Cape Town that I had been to in Africa. And I remember just being kind of like shocked at like how gorgeous Senegal is and what great infrastructure they have and all of that. It was pretty nice.
Yeah, and a leisurely work style, because I think we got used to kind of working through our weekends because there was not much to do. We had some things to do in like Kano, but it wasn't like most weekends were working weekends. Whereas like once you got to Dakar, like nobody worked because like the UN groups in Dakar don't work on the weekends because everyone goes to the beach or does whatever, right?
Yeah. So that was kind of a cool experience though. I mean, to at least see that. Yeah.
We also saw the election. like transition there during that time.
Did we?
Yeah, it was really weird timing because like what was it Macky Sall 1, I think? Or yeah, anyway. Because remember there was a week that we were there and all of Dakar cleared out because everyone was afraid that it would be not a peaceful transition of power. And then it just so happened to be in.
Yeah. That's funny. I do remember that. Like we were walking around and there was like nobody there and it was really creepy, but I didn't remember why.
No, it was because people expected there to basically be not a peaceful transition of power. And we were stuck there. So I couldn't really go anywhere. But then it was. And it was like the first peaceful transition to power besides like Ghana, you know.
And then to kind of like finish the UNICEF Nutrition Project, although it doesn't necessarily line up with the timeline. So then we went to Mauritania in December. And I remember specifically like getting the visas for the
Yeah, from Mauritania.
I remember I was crying in the embassy because I was sick. I was like sick and I had a fever, and they just like were refusing to get it done and just like doing the whole bureaucracy thing. And I just remember like bawling in the embassy until finally the lady felt bad enough where she like let me go to the director's office or whatever, where he hit on me and got my phone number and kept like messaging me later. But we got our visas, and you had gone ahead of me. And I had gone like, I think a week after you, because at that point, this is December 2012. So we had already started the polio EOC project. And I just remember things were like absolutely nuts for like that small period because we had to do this Mauritania trip. But we were also trying to finish the Kano and Abuja EOCs. But I do remember you went maybe a week ahead of me or so because we went there for December. And then after that, we went to Morocco for holiday.
Yeah.
Yeah.
And that was EOCs were starting then.
Yeah, that's December. Well, again, we're not talking about EOCs yet today, but because it's the UNICEF Nutrition Project, just to kind of finish out that year. But Mauritania was a really cool country as well that we got to go to.
Yeah, strangely interesting.
Yeah. And again, like for having almost nothing there, being just like a desert, was like strangely advanced, especially compared to Nigeria at the time.
Yeah, and I think that was the weird, wake up call. It's like a country that has 1/1000th of the economy. Yeah, so like all the donor money they needed. It wasn't like, I mean, there was obviously corruption everywhere, and Mauritania is like kind of a dictatorship, you know, it's not a very progressive democracy. But yeah, I mean, everything was just like work and getting things done. There wasn't a lot of bullshit. I mean, the visa part was, and the government bureaucracy was, but
that was also Nigeria still.
Yeah. But yeah, I just remember like people were just like doing stuff and working. And even when I went to meet the telecoms to negotiate the SMS rates, like with the different approvals, like people were just like down and ready to work. Whereas like doing that stuff when we were in Nigeria was just like pulling teeth.
Do you remember the really, I'm not talking about the alcohol thing, but another really stupid part about some mistake that you and I did when we were there that we forgot to bring, or we just didn't think to bring cash with us? Do you remember that?
Yes, I think so.
We didn't have cash. And so I remember we went to the ATM and we couldn't get any of our cards to work to get cash out.
Obviously, because we're in Mauritania.
Yeah. So then we went into the bank and they only spoke French. And then remember some guy was like, "Oh, do you speak Spanish?" And I was like, "Yes, sure." And then he started speaking to me in Spanish. And then we were like, oh no, I don't speak Spanish. And I guess UNICEF must have bailed us out of that because
I think Robert just brought cash with him.
Yeah.
Because he flew in afterwards because he was doing something else. But yeah, he just brought cash with him in exchange with him. Or I mean, they just took it from our per diems or whatever.
Something. Yeah.
Oh yeah, they converted our per diems to cash and he brought it with him.
That was learned our lesson on that one. Okay, so going back a little bit, so that's the Nutrition Survey Project. Anything else to say about that?
No, I don't think so.
So still we're talking like summer 2012. We start working, and this is obviously how we're going to get into some of the more of the polio work, but we start working with Victoria from the CDC on her polio nomads work. And I did look back and it looks like we got introduced to Victoria actually through Andrew Carlin.
It must have been,
Yeah.
And she was doing work at NPHC as well. I mean, obviously that whole time because she was one of the officers there. So she knew Steve. Because I was spending all that time working in NPHC's office for a long time as well. When was that?
What were you doing there?
You don't remember? We got a little bit of money for it, like a very tiny amount of money for it. I was doing the SMS system for the midwife service scheme.
Yeah.
And I helped set up their servers. I helped set up their network and the service room. I mean, all that stuff I think we did for free. And I think we got like maybe $10,000 for like everything else, like in a envelope. Like not even like through anything, just in an envelope. Yeah, because I literally was just there working out of that office the entire time.
It must have been during that time, and sometime in 2011 or 2012 would be my guess. I definitely wasn't there, so I was doing something else. But the Nomads work was fairly an interesting project. And actually, that was a fairly profitable project for us as well.
Mm-hmm.
I couldn't find what the original contract was, but I remember it being like 120,000.
Yeah.
We did ODK forms for the end stoppers.
We did a lot of GIS stuff. Because I was doing a lot of GIS stuff at that time.
For like the route mapping.
Yeah, well, I mean the mapping of the ODK, like pulling all the different data sources I could get together.
Yeah. And then at some point, and I'm guessing this probably had to do with the fact that we had just gotten back from Senegal, but in July 2012, that's when we actually decided to change our name from eHealth Nigeria to eHealth Africa.
Yeah.
Do you remember kind of like having those conversations or that decision?
Yeah, I remember specifically when you're working in other West African countries and you say you're eHealth Nigeria, people were just like, what? No, and so, yeah, we changed that.
And I think also, again, just having those experiences in such nice countries, we were like, we would like to work in other countries other than just Nigeria at some point.
Yeah.
Yeah, and then I remember kind of like having a discussion with you about like needing to redo the logo and all of that. And we found that lady and like it was like $500. But I remember that being like an expense at the time of like, this is something we need to invest in.
Yeah.
Like we need to do this.
Yeah. Well, rebranding.
Mm-hmm. Which I mean, $500 well spent.
Yeah.
So
Yeah.
that lasted us for a very long time. Obviously they changed the colors slightly, but I don't think it really matters. So that takes us up project-wise to basically October 2012 when we start the conversations for the polio EOC. It's funny because like in my mind, I look back at that time, especially around like with Andrew and these other groups, and I think back and I think like, why in the world did these people give us money? Like we were just kind of like bumbling around. I'm like shocked that they gave us money. In my mind, that's how I see us. But looking back, our proposals were really strong. Like we were incredibly professional. Like we did a ton of work. And so I think maybe it was just because like a lot of that time I had like such a big like imposter syndrome of like, oh, I shouldn't be here. Like, I don't really know what I'm doing. Thinking people were like being nice to us or something to give us all of this stuff.
Well, we were the only people doing ODK at that time, like on any sort of professional level in Nigeria. We were one of two groups doing rapid SMS because there's the other group in Lagos that was doing it, but they weren't going to travel to Kano or even Mauritania at that point. Because remember, there was another part of that project where we got that contract in Angola, but we just couldn't go.
Yeah.
So we contracted the other guys to do it. We like basically gave them the contract to do it and to wrap it up for them.
Yeah. But I think like it is funny looking back. It just like, I don't think that we were as random as I thought that we were. I mean, I think that we were actually, kind of like pioneers here doing these things. I think that we worked like crazy. I mean, we worked 24 hours a day, 7 days a week, and we were doing everything for really reasonable prices.
Yeah, and we were getting some stuff here and some stuff there. I mean, I kind of had to work for ESC Next basically to pay for our office and things like that. Remember, because I helped them redesign their whole server room. I helped them like redesign some of their like programming gateways for their billing and, did all those things. And like, but the cool thing about doing that is then we got to know all the contacts in the telecoms and the different groups. And so when projects did come up, we knew how to sort some of the technical stuff out. Because at some point when I set up the server hosting for Jihad, he was contracting that out like for like $15,000 a month. Like he went from, $0 in hosting cost to making $15,000 a month from one company just because he had that new server room.
I did not remember you doing that, but that does make sense. And it makes a little bit more sense then because I was going to...
Because that's also where we got some of our hosting of some of our apps as well.
Oh, yeah. It was a very mutually beneficial relationship because, I went back to some of these things and like they were managing our HR for our few staff that we had. They were managing all of our accounting at that time. And I guess like we must have been sending... How were we getting dollars into the country at that point? They must have been giving us Naira or dollars here, I think.
Most of it was... There are a couple local transfers we made, but most of it was like sending it to there because they had a business account in Beirut in dollars, and most of it was sending it to their account and then they would give us Naira. It was all small amounts, so it was never an issue.
But that was, I think, a pretty good relationship, for all of us. And obviously that was very helpful to not have to kind of set up some of those systems as we got started. But yeah, I mean, we did a lot of work and I think that we actually made a pretty decent amount of money for year 1 and 2 of our company, as we were just getting started. And I think that we did build a pretty good name for ourselves with those small projects that we did. So I actually just thought it was kind of nice looking back and just being like, no, like we didn't get a lot of this stuff from luck, or from people being nice to us. Like we put together really good proposals. we hustled and we got this stuff.
I actually think no one could really beat us on the price, because if you think about what people pay for development contractors and consultants at that time, and I think that's what pushed a lot of those things like ODK and Rapid SMS out of reach, because like if you wanted one of the groups to do it, it was in Europe or the US to come and implement a project, it would be hundreds of thousands of dollars, and we would do it for 40, right? I mean, because we could get everything together on the ground. And like most of those projects wouldn't be able to implement those technologies, wouldn't be affordable in any sort of real way if they used those international contractors. I think the only exception being like a group like UNICEF, they could have paid anybody, right? But I think we were probably a lot cheaper, and we happened to be there. So it worked out.
Mm-hmm. So I think, the other thing that I thought was kind of funny just to talk about was like, again, during these first couple of years, we were very careful with money. I mean, we were always very careful with money, but I think when we got the polio money, it was a little bit of a change in how we did things.
Well, no, I think because we still micromanaged every dollar. Yeah. It just became a lot harder because the order of magnitude changed by 0. Yeah. And that's a lot of work.
But I'm just like, those first 2 years, I remember like as we started getting paid a little bit of money, just like how exciting every purchase was. Like I remember when we bought that car, that was, well, one, I had never bought a car before. Like, I mean, so the fact that we bought a car with our own money was pretty cool. Yeah. And then also I remember buying our washing machine. And same thing.
I remember buying ACs, because remember how much we lived, how long we lived in Jihad's that up flat on the 3rd floor without ACs, and that was hot.
Yeah. Well, don't you remember we used to get up at like 5 a.m. and go to work because it was so goddamn hot in that room, and there was an AC in the office. So I think that's probably why we did so much, because it was more comfortable to sit in the office than it was to sit in the house. And then, do you remember? So at one point we had staff living in our house with us. We had Husseina, and then I want to say her name was Mary.
No, there was a Sarah.
Sarah. There we go. Why did we do that?
I haven't the slightest idea.
Yeah, I don't really either. Like, I don't know why we didn't just hire people that were living in Kano.
Yeah, I don't remember where exactly they came from, but they were both from like Kaduna.
Yeah.
So I don't remember how, but we offered them the internships and eventually like kind of entry-level jobs. But yeah, they couldn't find a place in Kano because it was just like, Kano still is really hard. If you're a single working female, like you just can't, no one will rent it to you, especially if you're Christian. And so they really struggled. And so eventually we just said, stay here.
Yeah, I don't know why, like how they even came to us or why we ended up hiring them instead of just local Kano people.
I couldn't tell you.
Well, I think that's everything on the list for today. So that leads us up to the polio stuff. And any other funny memories from that time you want to share? Anything funny from the travels for the UNICEF work or from working with Victoria?
I mean, nothing that really like comes to mind at the moment.
All right. Well, thank you very much. Thank you so much for listening to this episode of the EHA Founders Podcast. Please like and subscribe to our YouTube channel so that you can be updated on all of the new episodes that we post about our journey and about impact investing in Africa.